Welcome to this brief demonstration of the Medicare eMAR solution in partnership with the Boots eMAR implementation team. This demonstration has been pre-recorded and can be paused or replayed at any time if needed. If you have any questions about any of the information you are about to receive, please speak to your regional business manager or email emar@boots.co.uk. An eMAR solution has a number of key benefits. Some customer feedback we have received includes that eMAR reduces medication errors, increases patient safety, reduces time spent completing medication rounds, improves overall compliance, makes auditing easier and more efficient, improves visibility as access is available for all levels within an organisation. Medicare's online eMAR is a secure, web-based solution ensuring real-time access to up-to-the-minute information at all times. No synchronizing is required and no data is saved locally on individual devices, reducing the risk of a potential data protection breach. Our solution is fully GDPR compliant. Each user has their own unique username and password, which sets their level of access and permissions within the system. Here is the home page. This can be customized with a picture of your home or your organization's logo. Underneath, you will see details of the Medicare support line. Support is available free of charge 24 hours a day, 7 days a week. You can contact our knowledgeable and friendly support agents by phone, email, or via our new live chat feature. A wealth of help guides and videos are available in our support and e-learning sections. The latest news section is where Medicare communicate to users about system updates and planned maintenance. The announcements section can be used by the home team to put messages and information on. Here you can see an example message about some residents with time-specific medication. A link to the BNF website is also provided for quick reference. You will see all of the available modules on the green bar. Simply click on eMAR to access the eMAR solution. Here you can see the round summary screen, which shows you an overview of the medication rounds for that day. Round times are customizable. You can filter to specific units within the home here. The current round is highlighted in green, future rounds are yellow, and incomplete rounds are highlighted in red. Completed rounds are grey. This makes it easy to see at a glance the status of your medication rounds. If we look at the breakfast round as an example, we can see that 234 medications are scheduled to be given. 12 have already been recorded as administered, 14 as not administered, and 234 are overdue. Overdue medication is the same as a gap or missing signature on a paper MAR chart, and we can see that these are highlighted in red to take action on. There is also a section for medication that is self-administered. When we click into the scheduled round, eMAR can automatically check to see if there are any overdue meds, gaps or missing signatures from any previous rounds. If there are, the user can be prompted to add a note of explanation to maintain a complete audit trail. This feature is customizable and can be switched off if required. You will then see all of the residents that are scheduled to take medication in that round. This saves time as only those residents due to take medication are shown. You can work on the residents in any order. The photo is a simple and visual reminder that they still have medication to be given. You can search for a specific resident using the Find a Client feature. Simply click on a resident photo to begin administering medication. At the top of the page, you will see the resident's name, photo, room number, and any allergies and diagnoses that have been entered into the system. Below, you can see that Christopher has a note and an order set up. A note is person-centred information about how the resident likes to take their medication, making it easy for new staff and agency staff to meet your residents' personal needs and preferences. An order is an action that needs to be completed. The user must record that they have completed or not completed that action. Here we can see an example set up for Christopher to have his temperature checked and recorded twice a day. Below, you will see a list of medication that Christopher is scheduled to take in this round. Again, only the medication they are scheduled to take is shown, saving time. Here you can see the medication name, strength and form, along with the give dose and instructions. Any warnings and cautions sent by the pharmacy will also appear here for reference. You will see the last given date and time below, making it easy to ensure you are complying with the prescriber's instructions and leaving an appropriate gap between administrations. A great safety feature is that a warning message will pop up if you try to administer a medication before 4 hours has passed since it was last administered. This time frame is customizable if required. Clicking the Admin History button will give you more information. The Manage Order button lets the user make changes, such as to the schedule time or stock levels. It also allows you to place a medication on hold or discontinue a medication from within the medication round, giving you complete control. The Inventory button shows your current on-hand figure. Ordinarily, the Inventory button is blue, but it will change to orange or red if you are running low on stock or if the on-hand figure has gone negative. This prompts the user to order more stock or to correct their on-hand figure. Let's take a look at how we would record a medication as administered. You may be familiar with the pop and dot method from paper MAR charts. We use a similar feature in our eMAR solution. When you have popped or prepared a medication, simply tick this dot icon. Work your way down the screen, popping your medication and ticking the dots. If the resident takes all of the medication, you can simply click the Administer All Popped Items button to automatically record all of the ticked items as administered in one go. You can also record them as administered individually if you wish by simply clicking on the green Sign as Administered button. Here you can check and amend the amount and record any waste. You can also add a note if required before clicking Save. You will be required to sign controlled drugs and high alert medication off individually, as these will require a witness signature. A colleague must enter their unique username and password to act as a witness. If the resident does not take a particular medication, simply click on the red Sign as Not Administered button. Select the reason why they have not taken the medication from the drop-down list. Again, you can make a note if required and record any wasted medication as you go. This removes the need for a separate medication returns book. Next to the pop and dot icon is the Administration Notes icon. Click this if you wish to make or read a note about a particular medication. Here you can see an example where they are running low on stock, so have placed an order for some more. This aids communication and saves time. Here we see the biotest icon, where you can record test results such as blood pressure, temperature, heart rate, blood sugar and pain level, to name but a few. Simply click on Start to record the test result. You can click the History of Test tab to view past results. Lastly, we have our body map, where you can record where creams, lotions or patches have been applied, or record injection sites. The body map records at least the 5 last administrations, so you can ensure you are rotating sites according to the prescriber's instructions. PRN medication can be found by clicking the Available PRNs button, which will display the PRN protocols for review before administration, or you can find them by scrolling to the bottom of the scheduled medication. You can also view the PRN protocols by clicking the View Protocol button. Click on the green Sign as Administered button to record a PRN as administered. You must enter a reason why you have given the PRN medication. Medicare supports you to follow best practice to record the outcome of giving PRN medication, so the system will automatically schedule a reminder to go back and check that the medication was effective. This is called a follow-up. You can change the date and time of the follow-up here. If you don't wish to follow up on a particular medication, simply take the tick out of the follow-up required box. Click Save to record the administration. Once all a resident's medication has been recorded as administered or not administered, they will no longer appear in the scheduled round, making it quick and simple to keep track of who has and hasn't had their medication. You can offer a medication that has been recorded as not administered again if you wish. The system will keep a record of each attempted administration, creating a robust audit trail. The hot list is a record of all the outstanding actions. You can review and complete follow-ups, see overdue medication and treatment, your gaps or missing signatures, see and complete any biotests, and review your PRN protocols, all from one place. The hot list is the ultimate shift handover tool, helping to ensure that all necessary tasks are completed on time and in full. In addition to the hot list, the dashboard gives an overview of the key KPIs across the system. The widgets can be customised so that each user can view the information that is important to them. Here we can see medication follow-ups, medications not administered, low stock, expiring orders, overdue orders, your gaps or missing signatures, and orders waiting to be received. This gives complete transparency into the way medication is being managed across the home. There is also a full suite of reports available on everything from wasted medication to suggested orders. Users can customise the parameters of every report to drill into specific residents, units, or types of medication, giving you unprecedented access to real-time data at the click of a button. Let's take a quick look at booking in or receiving medication. Medication that has been sent by your pharmacy appears in Receive Orders for 2 members of staff to sign off and receive. Our validation feature will automatically check the name, strength, dose, form and schedule against the resident's current medication profile for you. Here you can see it has flagged this atenolol for Christopher as matched. This is a refill of an existing order. New order is a new medication for Christopher. You will also see orders flagged as order details mismatch and potential duplicate. By clicking on the orange buttons, users can review and resolve queries before the medication is booked in. Here you can see an example where the current order is scheduled at 10 p.m. but the new order from the pharmacy has come across at 8 p.m. You have options to start the new schedule, copy the existing schedule to new, or edit the order. Validation not only highlights potential duplicates of the same medication, but also ingredients. In this example, Christopher already has paracetamol on his medication profile, so this new order for cocodamol has been flagged as a potential duplicate. Users can choose to keep both or replace the existing order. Validation makes booking in quick, simple, and above all, safe. Before I complete this demo, I would like to make you aware that along with a proven implementation strategy, Boots have a dedicated eMAR implementation team who over a number of years have supported the successful implementation of over 500 eMAR care settings. We support this journey through face-to-face training and on-site support, supporting the setup of the new eMAR system, assisting you on go-live day with your medication rounds. If you wish to visit one of our reference sites or have any questions in regard to any of the information, please do not hesitate to contact your regional business manager or email emar@boots.co.uk. Thank you for watching.